The Trump administration has attempted to pause funding for the National Institutes of Health, a move that's been met with a lawsuit and a block by a federal judge. But if cuts do move forward, some here in Maine fear it means a delay in finding a cure.
We were going to have a child that would really only know like the inside of a hospital room.
When Samantha Rispoli's daughter was born, all she knew about cystic fibrosis, or CF, is that babies don't make it to adulthood.
We were grieving this like loss of a life we had dreamt for our child. We didn't know that that life was going to be possible for her anymore.
But all that's changed in the 7 years since.
The doctor said to us that she's so hopeful that we will see a cure for CF hopefully in the next 10 years, if not in Stella's lifetime.
The translation of really fundamental research over a period of probably 20 years.
Dean Madden heads one of only 7 NIH-funded CF research centers in the U.S., pioneering new medications.
There's a group of people with CF, about 10 to 15%, whose genetic variants don't respond to the drugs that we have.
Madden is currently in D.C. lobbying lawmakers to protect research funding at the University of New England.
Almost everybody who lives long enough gets arthritis.
It's keeping the lights on.
UNE has the most NIH funding of colleges and universities.
VP of Research Karen House-Connect says UNE receives about $17 million in federal funding for biomedical research.
Does that research get put on pause? What does that look like?
It could. We'll have to make very careful decisions, but yes.
For Rispoli, that research is keeping her daughter alive.
It creates this kind of pattern on her, so it breaks up any of the mucus that's in her lungs. So if I was somebody that had a child that didn't qualify for one of these meds, I would be holding on to hope for some of this research that's coming down the pipe.
In Portland, Stephanie Grinley, CBS 13 News.